Well, welcome everybody. Thanks so much for being here today. Happy Friday. It is our final day of webinars. I know some of the people that have been joining us have been so great and joining us for a lot of information all week long. So thank you so much for celebrating with us all week long and coming into the office and seeing a lot of you guys come in, ask some really great questions and getting some wonderful consults in. I am going to go ahead and have you hang on just a second. I want to make sure you can hear me okay. So I will resume in just 1 second. Hang tight. All right, guys, I think that's better. We are celebrating 13 years this year, and we are giving away $13,000 in giveaways. So just for attending, you get to be part of our raffle, and it's all about coupling powerful therapies and products together. Now, if you were with us for yesterday's talk, a lot of that will be a continuous theme today, in addition to talking about some skin cancers and other things that we want to be very, very cautious of. So for those of you who did come in yesterday, you'll get even more learning today. Next slide. So it's all about sun damage. If you were one of my baby boomers back in the day, I got a lot of sun and did the baby oil and the iodine or sun tanning until you were darker than me, this talk is for you. So it's so important. Now that we've done the damage, what do we do? How do we reverse the sun damage? How do we do preventative work? So today it's all about solutions to prevent and treat sun damaged skin. Next slide. So if this looks like you, where you do have sun damage and brown spots, getting lines and wrinkles, pigmentation issues, your skin is thinning out, you're seeing more redness, you're seeing more capillaries, you're seeing other little new spots that are developing that you didn't have before. You're getting more moles than you thought you ever had. You know, these are all signs of sun damage. Next slide. Other things that I might see are, again, more of these, what they call liver spots or age spots. Has nothing to do with the liver. It actually all has to do with sun and sun damage. Next slide. So those are the cosmetic things that I'll see. And I'll tell you, oh boy, there are some people that have laid out in the sun for years and years and without their sunblock, especially because back in the day, we didn't have sunblock and it wasn't stressed. But here is a really, really famous slide of someone who's older still getting sun, even though their skin has become leathery and just, gritty and just textural changes. It's got brown spots. It's probably loaded with pre-cancers, skin cancers. She's probably had surgeries done, but doesn't care. She loves her sun. So here she is with that leathery skin, and you don't want to be teaching the next generation to not wear their sunblock. Next slide. And by the way, feel free to use our chat box if you have any questions along the way. I'll be happy to answer it if time permits. And either way, we'll definitely be available for questions, or you can DM us on Instagram or give us a call. So here is really why I'm here. It's because I want to make sure that we give you the tools and you understand the importance of skin cancers and prevention. So if you have sun damage, you're a much higher risk of developing these precancerous spots. They look like these rough, scaly, ill-defined patches under the skin that may have just started developing, or maybe you've had them for a long time and you keep getting more and more and they keep cropping up. Once you develop these, you're going to continue to develop them for the rest of your life, because the more sun you've had over the years, the more of these will start to develop. They're deep in your skin and they don't come up until at least a decade or 2 decades later after the sun damage has already occurred. Next slide. Left untreated, these precancers can develop into skin cancers. So that's really important, is what do you look for when it comes to skin cancers? Because just yesterday, I was in the office and we were seeing her for a cosmetic spot on the nose. And she said this spot has been there for some time. It's new and it's growing. And looking at it and evaluating it, it looked like it could be a skin cancer, and she had no idea. And she was referred over to the dermatologist to biopsy it, which will likely come back as a skin cancer and will likely need something called Mohs surgery, which this lady had had. Here you can see that small little spot can actually be deeper and can penetrate even more areas of the skin. And you can see the scar that's left behind, much bigger than what she anticipated. And it can be quite devastating for a lot of people. Thankfully, the face is one of the most vascular areas, and it actually heals up the best of any other body part. But it's something that you don't want to have to go through if there's a way that you can prevent it. Next slide. So the reason why we want to prevent skin cancers is because there are deadly forms of skin cancer that you want to get evaluated and treated early. 100% of skin cancers that are detected early are treatable. Most of them are going to be preventable, and that has to do with the prevention of sun and making sure you're doing everything you can to sun protect. So on the left side here are what normal moles will look like versus on the right side what cancers will look like. So normal moles, they tend to be symmetrical, round, one color. They tend to be small. They could be a little larger, but they tend to have those characteristics in common. They're not changing or evolving. Versus cancerous moles can look very different. The way you can remember what to look out for is the rule of A, B, C, D, E. So A is for asymmetry. Any mole that is gotten to be asymmetrical, so the half doesn't match the other half, is considered asymmetrical. That needs to be evaluated. B is for border. If it's got jagged borders or uneven, crusty or notched borders, it should be looked at. C is for color changes, especially if it's getting darker or it has different colors. It's got dark black, blue, white, all of that is not a good sign. D is for diameter. So a mole that is getting bigger in size. Anything bigger than a pencil eraser should be evaluated once a year is what we do recommend. E is for evolving. So if you're not quite sure, what's going on, is this evolving, is it not, definitely come in for an evaluation. A lot of times the dermatologist will take pictures, or you can take your own picture of the mole and track it over time to see if it's truly changed. Next slide. And so what are the most common types of skin cancers that we see? Well, precancers, long name, are called actinic keratosis. They present first. They present as scaly, rough patches on sun-exposed areas. Another kind of very common lesion that we see are atypical moles. Now, these are not cancers, neither are actinic keratosis, but they could be precancers that may evolve with time. Atypical moles tend to be a little more different than your regular moles on your body. They tend to have some of those patterns that we discussed, the A, B, C, D, but they haven't fully evolved into melanoma, the deadly form of skin cancer. Melanoma is the one you absolutely want to detect and treat early. That can spread much faster versus squamous cell carcinoma, basal cell carcinoma. They're really common on sun-exposed areas and in fair-skinned individuals. However, they tend to not necessarily metastasize or spread to the other areas of the body unless they're left untreated for years and years and years. But they are totally and completely treatable, and especially if caught early. Next slide. So what are the reasons? Why are we more prone to getting sun damage, more prone to getting precancers or skin cancers? Well, we definitely know that sun, as we mentioned, plays a huge role in this. UVA and UVB are, especially in fair-skinned individuals where you don't have as much melanin or protective sun protection factor, allows for UVA to go deeper into the skin. UVB goes a little more superficially, but those are the reasons why you get skin cancer such as melanoma, basal cell, and squamous cell. I think UVA goes deep. It is mainly for aging, but it is more common to have melanomas develop as a result of UVA. UVB is burns. So if you tend to burn, you're more likely to get basal cell and squamous cell carcinomas. We certainly know genetics play a huge role. So if you have a family history of skin cancers and precancers, you are at higher risk of developing them as well. We know that the aging process definitely gets you more prone to developing spots, new spots, and brown spots. One of the worst things you can do for your skin, and I still see it, especially when I'm at the beach, is sun tanning. Sun tanning and tanning beds are even worse. Um, Suntan is a sign of sun damage, and sun damage is what leads to all of these brown spots and all of these precancers and skin cancers that we talk about. So there's no such thing as a safe tan. You want to definitely protect yourself. It's fine to enjoy the sun and enjoy yourself while you're out there, just as long as you're protected. Sunburns is one of the worst things you can do for your skin. One sunburn doubles your risk of skin cancer throughout your lifetime. And I can imagine all my baby boomers that I see, they tell me all the time, well, they just baked out in the sun, so they burned all the time. That was just a regular day at the office for them. And that's why they come back to me and we see these skin cancers develop, and then they need to be tracked and monitored much more carefully. So it's very important to prevent sunburns. Next slide. So what are the signs of sun damage? Well, if you're fair skinned and you had some sun back in the day, or one thing I hear a lot is, well, you know what, Dr. Sonia, I'm not outside in the sun. Well, you don't have to be outside in the sun to get sun damage. You could be commuting in your car. And we have that misconception that we're not outside, we're in the car. Therefore, we're not getting the sun damage. And unfortunately, you still get ultraviolet radiation through the clouds, and especially through the windows, especially even if you're at home, you work, by the window, you're getting UVA and UVB damage. And that is a precinct to developing skin cancers. So other side effects from the sun are going to be wrinkles, hyperpigmentation, more textural issues, showing up under your skin, capillaries, more uneven skin tone, some ruddiness, and some sagging skin. So all of these are precursors and signs of sun damage with time. Next slide. So my approach to treating everyone is the same. If you've been part of my talk this week, you know now the 360 protocol, the 4 Ps to pretty skin. The first P I like to do is I've got to prime your skin with the best products possible so that we can go deeper in the next P, which is to peel and exfoliate some of that dead skin layer. And then the third P, now we can do these procedures that can now go deeper into the skin and really help penetrate active products and lasers and procedures to give you even a better result. Then the final P is to protect your investment. You are spending a lot of money doing all of these things in my office, and it is so important to maintain yourself at home with the right stuff. Next slide. So let's go into the first P, which is using medical grade, physician grade skincare. Why? Yes, it's different than over the counter because we're going to have higher concentrations of the good stuff, higher concentrations of the active, clinical science behind it, penetration to the target. Next slide. So what we're talking about now is brightening the skin. If we've got sun damage, what can we do to help with those brown spots and those lines and wrinkles and the textural issues and the pores? What are some things you can do just to baby step or prime your skin? So the brightening kit is one of my favorites. It's one of the most popular. It was specially designed and handpicked by me because I wanted to be able to put together a system so it's quick and easy and simple. So you're not confused. You're not sure what step goes with what. How do I use my products? Does this work? I tried to get all that guesswork out and I put the kit together. So this QR code you can actually use to scan if you'd like and be able
products actually work better, guys.
We're just going to go back there. So if you want to use that QR code to scan, you will actually go directly to the site itself and you can actually get the brightening kit. Don't worry about that sensitive skin down there. We're just updating some slides last minute. Next slide. Brightening kit has got 4 products in it with the higher percentages, with the good active stuff to really get down and dirty with the results. So it's very, very important to use this at home with consistency and you're going to get results. So I love this because it's easy to follow. It's 4 steps, 4 minutes every single day. The first is one that I love that I use. It's a brightening scrub. I love that exfoliating effect on my skin, and it helps to, again, start exfoliating my skin and allow the products to work deeper. So if you've got a lot of brown spots, this brightening kit is going to be for you. Next step will be a brightening serum. Again, one of our popular ones. This one I can never keep in house. It always sells out. It's a collagen brightening serum. It's got an active high potency vitamin C. Not all vitamin C's are the same. So I will say that vitamin C's are very, very, very difficult to stabilize. And the way that it's manufactured and delivered and packaged is very important. So this is a very high potent strain that is going to do the job with helping to shut off those melanocytes or that pigment containing cell to really help with alleviating those brown spots. Third one is actually a new product that we did launch. One of the things that people had told me, we have pads, which are really great with a lot of brighteners. This one actually is dual function. So we just got this in. It's a glow booster cream and mask. I love the dual acting product because you could use it as a cream. You could also use it as a mask to just kind of keep on there, even overnight or just a few minutes. And it will help to penetrate into the skin to help with even more with brightening your skin. It does not have any hydroquinone or any drug. It's a drug-free formula, which is what people like about it, and very safe to use. Final step, absolutely need the best sunblock possible. This is the Sheer Sun Shield, and this is going to give you a high level of zinc oxide protection, which I'm a big proponent of. It's a mineral-based sunblock. And one wonderful thing about this whole program is that, sunblock is your step 1. Number 2 is using antioxidants regimen. You are going to be set with all of the best sun blocking and screening things that you can do to help with sun protection. So this system will give you the benefit and the biggest bang for your buck. Next slide. The beauty is that everything will be written out for you. Everything will be explained. This is actually even on our website, how to use all of the products. It can come in easy printable instructions, or at the office, we have brochures that you take home with you that will tell you exactly how to use everything. And the goal is really, to get you brighter, smoother skin with better texture, in just a few weeks. So if you're consistent and you are using your products every day and you are doing everything you need to do, you are going to do really great after just a few weeks of using this. I always say diet is always great. Try to get as many antioxidants as you can in your diet as well. Drink a lot of water. And so you're really helping the health of your skin inside and out. Next slide. Now let's go on to the second P, which is peeling and exfoliating the skin. We're going deeper now into the next layer of the skin. Next slide. So a couple of different ways that we can do that. One is you can make an appointment to see our clinical esthetician. She can individualize a treatment program for you. My acne patients will do this a lot because there's a lot more extractions that are needed. We can also individualize a chemical peel, and that will help with tone and texture. And it's a really nice little spa-like treatment as well. Next slide. We also have another option, which is called Hydrofacial MD. Again, one of my personal favorites. It's what I do when I'm in the office. It is a great kind of microdermabrasion of the future. It does 4 or 5 different steps in one. It will help to exfoliate the dead skin layers, but also help to infuse vitamins and antioxidants and the good stuff back in your skin in the same treatment. Another spa-like treatment. There's no downtime. There's no irritation. It's sort of what we call our red carpet treatment. So right before a event, a great time to do it. Gives you an instant glow, and it's something people will use probably once a month and do once a month to kind of keep everything maintained and preventioned. Next slide. So we're going to show you a couple of videos on this. And here's the first one. Wonderful. So it gives you an idea of all of those steps. Now we'll go to the next slide and you can actually see the treatment with and how deep it actually goes into the skin while infusing the vitamins back in.
The HydraFacial MD HydraPeel Tip's unique spiral design and powerful hermetic suction provides unparalleled non-invasive skin resurfacing and temporary pore opening to effectively cleanse, exfoliate, and extract impurities evenly without damaging the skin, while simultaneously delivering proprietary serums to the skin. The first step in the HydraFacial MD treatment, vortex cleansing and HydraPeel exfoliation, gently cleanses the skin and effectively exfoliates the stratum corneum layer, removing dead skin cells and sebum. This allows the skin to reflect more light and appear brighter and healthier. The second step uses a non-irritating, effective mix of both salicylic and glycolic acids to help loosen deep pore debris and dirt. This may prevent the formation of the pustules involved in acne. The third step uses painless vortex extraction, providing strong vacuum suction to automatically remove blackheads and other impurities. The fourth step in the HydraFacial MD procedure applies vortex fusion, delivering a pro-antioxidant formula with potent peptides and hyaluronic acid into the skin. This step provides detoxification, rejuvenation, and restoration for healthy skin structure and function.
All right, so here's some before and afters from the HydraFacial MD procedure. Again, helping with texture, pore size, even acne, helping to extract all those impurities, helping with brightening and lightening some of those brown spots, and it's just going to give that skin an added glow. Next slide. You can see me getting the procedure done here, and just very nice and very spa-like.
Hi guys, I'm getting my HydraFacial done and it feels so great to have it done. I feel like everything is being exfoliated out of my skin. The pores are deep cleaning, resurfacing. Products actually work better. They penetrate deeper into the skin. And that is the best part, is all the extraction. So we get to do. So guys, I'm just mildly red and I have a couple little spots of like little hyperpigmentation that we're going to be working on right there. And nothing hurts. Everything feels really fresh. Final step, the antioxidant boost serum. This is going to help with protecting my skin against all the damaging, harmful things of the environment. Already feeling and looking very glowy and dewy.
Okay, great, thank you. So next slide. I love it because I could use it.
Hi guys. Hi guys, so I'm getting the HydraFacial.
And I can do it actually off the face as well. So all skin types, everything, every skin type, skin color is safe. It's my, easy baby step program that I get people just started to, again, lift off those dead skin layers and start getting some result in a very easy, painless spa-like treatment. Next slide. Now we get into the deeper layers of the skin. And now we're doing some more really heavy duty, more active procedures to also give you better results. Next slide. One of the more common ones that we do are lasers and light therapies. We have, 40 different lasers in our office. We are a training center for other doctors all around the world and other healthcare workers. So they come to us for the latest and greatest techniques and innovative procedures that we do. And so we're lucky we get to combine different procedures and modalities to really get you the results you're after. This is one of our favorite easy treatments to do because there is no downtime. So anyone who's got two things, red or brown spots, if you've got red or brown spots on your face or your neck or your décolleté, chest, hands, we can help zap these. We can actually even do it on the arms and the legs. Just takes more time and patience, but it's an easy treatment to do. Usually we put a gel on there to protect the top layer of your skin, and then we basically zap away. These brown spots may get darker over a few days, and then they just exfoliate off and get lighter with time. Next slide. So again, I love it for my fair skin. So not so much my skin of color. It's not the safest one for darker skin, but really great if you've got fair skin and you've got some redness or rosacea, got brown spots, sun damage, blemishes, even acne, any of those red or brown spots there, it will just help to color correct. So it'll really help diminish the spots that you see today, but even more importantly, the spots underneath the skin. There's actually a really scary picture I'm going to show you later. It's all about the sun damage. The top layer is just what we can see, but if we look deep with this UV camera, we can see all sorts of stuff under there. And what's great is these lasers and light treatments are going deep, and they're really zapping and targeting those deeper brown spots. You're going to get less of them over time. Very preventative. Next slide. One treatment that I also love is called the E-Matrix. This is really wonderful for my skin of color patients. I use it for acne. I use it for textural issues. I use it for, some mild brown spots. It's not my brown spot treatment, but it does help to just kind of retexturize the skin, especially if you've had sun damage or acne scarring. It's a wonderful treatment I could use in all skin types. Maybe about a weekend of downtime where you're going to be a little red and sunburned look, but relatively easy treatment. We do use topical numbing, and feels kind of like a warm, prickly sensation. Again, we're going deep with radiofrequency to really heat up that and bulk heat the dermal layer to help rebuild collagen into the skin. Next slide. And this shows you the pixelated delivery of that energy so that you do have skip areas, but that's the point. So you don't get so much of that downtime and you get immediate healing. Next slide. And so here are some of our before and afters on the next slide, with some of the brown spots and the textural issues that you see. Next slide. And people, especially with hyperpigmentation and scarring, can really be helped with this. Next slide. So my favorite treatment option is actually this. It's a CO2 resurfacing, and it can be used for all sorts of things. Next slide. Even though we're talking about acne here, use it very most commonly on our sun damaged skin. This is really for somebody who wants to get the big bang, wants to get one treatment and you're good for some time, and helping a lot of different things in one session. So if you have lines and wrinkles that you want to target, if you've got some benign dark spots you want to target, sun damaged areas, acne scarring, textural issues, all of this pore size can be helped with laser resurfacing. This is my gold standard for all of my baby boomers. If I can get you on this program, this is where it's at. Next slide. And here's why. Really, we're helping a lot of things in that one session. And, people are willing to do maybe some of the downtime that it takes because it's helping all of these benefits. It's improving your scars. It's diminishing fine lines and wrinkles. We can actually go closer to the eye area where people will have the lines, or the perioral around the mouth area, especially if you've got, just lines from lots of muscle movement, smoker's lines. Those are really difficult to treat with any other modality, but it will help to tighten some of that skin. And there's no laser that works really great like this does with tightening some of that loose skin around those areas, and one that is also safe enough to do. So it'll lessen the appearance of wrinkles and crow's feet. It will help to soften up some of those pucker marks around the mouth or the frown lines. It will help to diminish some of the brown spots, age spots. It will help to improve the overall tone and texture. And here's the kicker. My favorite reason is it's going to prevent future precancers and skin cancers. And that's really what I love, is because I get to help both the health of your skin as well as the cosmetic benefits. Next slide. So, CO2 lasers have come a really long way in the last couple of decades. So if you are one of those that lived through the very first generation, it was quite a process to do. It was very ablative, meaning there was a lot more tissue damage that was done, and therefore a lot more downtime of like a month back in the day. Did get really great results, but very few people could do that kind of downtime. And so over time, what's happened is there's been more of the newer generation of CO2 lasers that offers fractionated or pixelated delivery of the energy, going deep into the dermis layer. That's where we want to really target, where all of the collagen building is happening. My number one rule is invest in as much collagen building as you can, as early as you can, because we know collagen decreases 1% per year after the age of 20 over your lifetime, even worse around the menopausal, perimenopausal years. So it's so important to do seek out, especially if you don't want surgery later, to seek out those minimally invasive or non-invasive procedures that allow you to do this non-surgically. There are two types of laser resurfacing that we focus on with this machine. We can go light and go superficial, depth of injury, controlled injury, or we can go deep. So if I am able to tailor a program for everybody, my goal is always to go as deep as possible to get you the best results possible. Now, the downside of that is there is downtime. So with light laser resurfacing, actually with deep laser resurfacing, I should say, it's about 1 to 2 weeks where you want to stay inside. You don't want anyone to see you. You do not want any visitors. You're going to feel fine. It's just, you're going to look awful. You're going to look like you've got a sunburn reaction until the skin is healing. When it does heal, comes back tighter, cleaner, more uniform, and you get to see the results every day for the next actually 6 months, because that's how long collagen continues to build. So if you're able to do a deep laser resurfacing, that's going to go deeper to get you the best results. However, I understand not everyone can do that downtime. So we also offer a light laser resurfacing option. With that, you're still getting superficial targeting of lines and wrinkles. You're still rebuilding lost collagen. You're still helping to diminish some of those brown spots. Your downtime, however, is going to be less, 5 to 7 days. So the good news is that that is something that a lot of people are able to do. And they tend to repeat that maybe a couple times in a year or once a year. And that's a really great preventative protocol for them. Next slide. So here are some patients who underwent laser resurfacing for various reasons. In this case, it was some brown sun damage spots, as well as some acne scarring, and just textural issues. And you can see the before on the left of 2 different patients, and really help to smoothen the skin out in the after. I mean, their skin just looks a lot more to life, has a lot more glow to it, and a lot more correction, and discolorations diminished, lines and wrinkles are diminished. And that's the beauty, is we're able to achieve these results without surgery. Next slide. Here's another patient who had it done. She is a hiker and an outdoorsy girl. She is always outside. She tries to protect herself, but she lived out in the sun since she was a child. And that's what keeps her really active and toned up and really healthy. But the downside is she had a lot of brown spots and precancers and things that she wanted to also take care of and prevent. So she was able to get the deep laser resurfacing and just help to smoothen out her skin, her texture. You can see the tightening effect also even around her eye area, which is amazing, and the mouth area. Next slide. Here's a patient who underwent actually a combination of treatment. Because at Elite MD, we've got the gold standards. We can combine and tailor programs. So in this case, she had lots and lots of brown spots. You can see on the left, superficial sun damage. She was still young and she wanted to get ahead of this. And so she underwent laser resurfacing combined with the IPL light source. And she got a wonderful dramatic result, but still very, very natural. And she was so very happy with it because it helped to, make her look natural and, reverse the clock a bit for her. And she wanted to prevent surgery for later. Next slide. What's the beauty is we can also do it around the eye area or the mouth area. And that's what I love also is we can be very focal and methodical about where we want to target lines and wrinkles. I always recommend doing a full face only because if you've got sun damage, one area you likely have sun damage in other areas. So we'd like to prevent as much as we can and make everything look even. However, there are some patients who just have really deep lines or wrinkles that they want to target around the eye or the mouth. And you can see that she just got more tightening. She got more color correction. Again, very natural, and was able to do this, within, a couple of weeks of downtime, and she's very happy. Next slide. So what can you expect? I like to go over the downtime so that you can schedule that out. You can plan for it. So after you're done with the treatment, usually we'll numb you up. We will do the treatment, takes about an hour. After you're done, you'll have a little white frosting, a little bit of redness. The next day is really when things start to kick it up. You'll get more red. You can get some peeling after that for a few days. But the beauty is the skin will regrow and it will heal. And that new skin that comes back will come back in cleaner and tighter and more even skin tone. And so generally we'll say about a couple of weeks where you're going to have that. But again, it still continues to heal even after that. And your results will continue to manifest over 6 months. Next slide. And here's a demo of laser resurfacing. This is mostly around the eye area, but you'll get the idea here.
Bansal at Elite MD, here with the Elite MD Dream Team. Kataya comes from Modesto, and you can see her upper eyelids need a little bit of work, and everyone told her she needs to have a cutting procedure. However, she feels she's so young for that. And so we're fortunate at Elite MD to have a laser institute, and you're going to see with a laser how much skin tightening we're going to get. It's not going to be the same as doing upper blepharoplasty, but watch this ray. You'll see how much skin tightening she gets, okay? So I'm going to go right in here. 1, 2, 3. 1, 2, 3. 1, 2, 3. And can you see, Ray, the skin tightening? Look at that. Right in front of us. The skin is tightening. This way she doesn't have to get anything cut. Katia, how are you doing?
Awesome.
Much pain at all?
No.
Awesome. So thank you guys. Wanted to share that with you. Again, that's called fractional laser resurfacing.
Okay, wonderful. Thank you. Okay, so that gave you an idea of what laser resurfacing is like. That was done by my husband, Dr. Bansal, in the plastic surgery division. A lot of times we'll combine it with actually a lot of things that they do on their side, which is more surgical, such as mini in-office mini facelifts. And so while we're helping with sagging and jowling, we'll also color correct all at the same time. Or instead of a blepharoplasty or eyelid surgery, we'll try to do some of the tightening techniques with laser resurfacing. And people are really happy to have non-surgical options as long as they can do the downtime. But it's great because we have options for you. So we always recommend coming in for a complimentary consultation to see, what is the right fit for you. And certainly we'll have some specials designed today and promotions that will allow you to determine which will be right for you. All right, next slide. So now that we've done all of this work in prevention and treatments, we've been using our skincare every day. We've been doing our hydrofacial MDs. You're seeing our clinical esthetician. You've got your lasers set up. It's so important to do your homework. So you've spent money doing this, and it's so important for you to protect that investment. So the treatments that we recommended in office is going to be similar to what you do at home, which is resurfacing and helping with actives into your skin. So brightening kit is a great one to stay on for prevention, along with maybe doing a little booster. This is where we add products. Maybe we are haven't used our retinol in a while. It's time to get back on our retinol, and maybe we're on a lower strength. It might be time to kick it up a notch or go higher in some of the concentrations and ingredients. So that's where we do a lot of our tweaking. Next slide. So here now, we are here to offer you all of the specials and promotions that we have when it comes to sun damage. We've got actually quite a few all week that we've talked about. These are specifically handpicked by our team to give you the best results possible. If you're undergoing sun damage and have a history of precancers and skin cancers, these are the best specials and packages for you. So the first one here is a sun damage package, which is 33% off. By the way, our kits, all of our kits are 23% off, and you have the QR code. You can see all the kits there. And that will allow you to get everything that you need based on a specific skin concern. These are all in-office treatments. So the sun damage package, if you've got fair skin and you've got maybe some redness and some sun damage, this one includes hydrofacial, 3 hydrofacials and 3 IPL treatments. Remember, no downtime, pretty easy treatments, but that's going to get you color correction. The ones we recommend are the next one, which is our Elite sun damage packages. So our Elite packages, they are transformative packages up to 43% off. So this one is really helping you to get the biggest bang, the best results for you. So the first package really is getting a light laser resurfacing. By the way, this all comes with a free, these packages come with a free kit. So the Elite package will come with light laser resurfacing as well as 1 free brightening kit. Package 2 is a deep laser resurfacing with 1 free kit. So I would definitely highly recommend doing one of those if you fit into the candidacy of being fair skin and have sun damage. If you have skin of color, that's where an E-matrix option would be great for you. And we do have specials on that as well. Next slide. For everyone attending today, we are also offering a free Vizia skincare analysis. So what is the Vizia skincare analysis? This is the scary picture I was telling you about. So if you've never had this done, it's kind of cool. We get to see what is lurking on underneath your skin with this tool, this photo camera. Basically put your face under there and we can assess a lot of different things. So we can assess how much UV damage you've had under your skin, how many brown spots are under your skin, how much redness you have, even porphyrins from acne, pores, texture, wrinkles. So we can assess about 8 different factors that you can't see yet. So this is a really important tool that we could actually use for also recommending long-term treatment solutions for you. So this is an offering for everybody here today. And you can just call in our office and let them know you heard about this and you'd like to come in, and one of our skincare consultations can get you in for that. Next slide. And here's another wonderful program that we do have. And I'm going to let Ruby come on in. She is one of our Elite Club partners who is going to tell you all about the amazing benefits here. If you're not already part of the Elite Club, you'll get to hear all of the wonderful benefits, and we hope to see you there.
Thanks so much, Dr. Sonia. Hi, everyone. I am going to speak with you all about the Elite Club here for a few minutes. Everyone, all our patients really are loving the Elite Club. It really just offers us some additional financial flexibility when it comes to those services that you want to receive or have already been receiving. So how it works, you are signed up for a customized treatment plan with an affordable monthly payment. And with the club comes some amazing perks and benefits. So not only do you lock in 15% off of some of our most popular procedures, but you also receive 53% off the packages and some free gifts. So the plan does require a 6-month commitment, but after the 6 months, you do receive a free hydrofacial. Super exciting there. And other exclusive specials and priority appointment booking. So, you're always paid off. It's not like a credit card, no hidden fees, interest, or financing, anything like that. Really just think of it as a monthly investment towards your skin health and building up those funds to go towards the services that you're enrolled in. So, You also have access to the Elite Club app. And if you go to the next slide, please, Elaine, it's just a little, summary of how the plan works. Basically, you're signed up for a plan, you receive your treatment, and then you can track the next time you're supposed to come in on our app there. Yeah, so definitely, anytime you're in the office, please ask the staff about the Elite Club and how you can sign up.
Thanks so much, Ruby. Really appreciate all the information. Yeah, it really is like this Netflix subscription is the best way to think about it. Just paying a low monthly payment depending on what your needs are. So you can come in for an assessment. If you're already getting Botox done or fillers done or hydrofacials done, we can actually put together a long-term program for you. So you never have to worry, when is it time for me to come in? What should I be doing for prevention? We can help you through it, and every year reassess you to see where you're at, or if we need to make tweaks along the way. And based on our our assessment of you, then we basically can tell you exactly what that low monthly fee looks like, and you just show up for your appointments. So I love it for our Elite Club members who are already enjoying it. You do get some free perks, including a hydrofacial procedure at 6 months. And then of course you are first in for all of our cool new innovations that we bring on board. Next slide. So resources are always really important. I get asked all the time, well, where can I find, resources on everything you're talking about? I love writing books and I love writing articles. So our website is a great place for some of the blogs. We've got some books out there on Amazon. Be very cautious of Dr. Google and what you read over there. You want to go to trusted sites and just make sure that you are getting the right information. Or just to see us for a complimentary consultation, we can walk you through exactly, what's right for you, what's working, what's not, what's hype. And that's so important. In addition, one other thing that we are offering as well that I wanted to let you know, Skin of Color is deep, passionate part of what I do. And it's so important for me to help you with keeping your skin healthy for life. And one thing that we weren't doing as much during COVID, just because we were restricted with the amount of people, is offering free skin cancer screenings. So I encourage you guys to come in, call us for a free skin cancer screening. If you're worried about moles and you can't quite get in to see your dermatologist or whoever you need to see, we're happy to help you and assist you in that, and at least give you reassurance, because I know I've been there and I've seen those people who are just worried about these spots. So we do offer a free skin cancer screen, and we'll be happy to take a look at your moles. It's usually about a 15-minute appointment with our experts, and they can at least advise you on what to do. So you guys get a lot of perks today: free Vizia skincare screening analysis to really look at your sun damage, free skin cancer screening as well to make sure everything is safe and looking good. And then 23% off kits, 33% off packages, 43% off the Elite Transformation packages, and then 53% off if you join Elite Club. So there's a lot of things that you guys can definitely take advantage of. The first 10 people to book will get a free gift as well. So definitely give us a call, and the first people to actually book procedures will also get a gift. So definitely don't want to miss out. If you're not able to come into the office, you can also text us your pictures and we can help you that way. If you're really not able to come into the office, or give us a call, just go onto our website. You can also get a gift card. Mother's Day is around the corner, so I always say, hey, just get a gift card for yourself or a loved one, so you always have it. One other thing that we are doing, I didn't get a chance to talk about, is something called photodynamic therapy. So we are going on Instagram Live, either our live, or we're going to do a video recording. We're going to see what our patient's able to do, but you'll get to actually watch a procedure that we had done back in the day that we're bringing back on board, called photodynamic therapy. For those of you who do have pre-cancers or skin cancers, or have some rosacea even, or have some acne, really works well for them. It's an acid treatment that we put on the skin, on the face. You wait in the office for about an hour, and then we illuminate you with blue light treatment. It helps to actually kill off precancer cells under the skin. So we're having a live model do that for us. You'll get a chance to actually see that. If you're interested in the procedure, please let us know. I'd love to be able to get an interest to see how many people are interested in having us bring that back. I think it's really great for people who can't do the downtime. And so this is just another alternative and another way to keep your skin healthy. So definitely join us on Instagram. for that. And then I think that pretty much concludes our anniversary this week. Thank you guys so much for joining us. I can't tell you how excited I was to have you guys here. I saw you guys in the clinic and you guys were all excited, and I was so happy to meet you. I just really, really appreciate you guys taking the time and effort to come in and learn and be educated and be informed, because safety is the most important thing. Even if you're not ready for procedures now, at least you know what's out there, you know what works and what doesn't, and you know fact versus myth. But I want to definitely commend you guys for joining us. I want to commend my team. Elaine's been on, and she's been like the one who's been really helping me with all these slides and helping us with all the text. So thank you so much. Our international team has been amazing in helping us with all of the back end things. And, you know, our team at Elite, of course, are so elite. They are there for you. They're all standing by to answer any questions that you have. And we are open on Saturday. So that's the good news, is you have one extra day to shop, and then look out for more announcements on our newsletter. I hope you guys have a wonderful weekend. Thank you guys so much again. We love you and hope to see you guys very soon in the office. Bye-bye.